Hi everybody. We are going to do another positioning video. We're getting a pretty good catalog going here in the next few weeks. We'll have them all done and you guys will be able to look at these whenever you need to. So today we're going to do a Tibia Fibula series, or a TibFib for short. The projections are an AP and a lateral. It's a long bone, so we only do 2 projections. 40-inch SID, and I say SID, it's source to image distance, the distance between the tube and the image receptor. Okay, no angulation of the tube. Central ray is just the mid shaft of the TibFib. Okay, we need to include the entire lower leg. That includes the knee joint and the ankle joint. Okay, we need to make sure we get all of it. If you can't get it all on one picture, you have to take an upper and a lower. Okay, but the knee and the ankle do need to be on there. So we also want to include the medial and lateral skin margins, and on the lateral, the anterior and posterior skin margins. Okay, so we can see the calf muscle. We're going to shoot these at 65 to 70 kVp. 65 will give you a little bit better contrast. 70 is okay though. And we're going to go 10 to 12.5 mass depending on the patient's size. Just a tip about these, when we're shooting the APN lateral TibFib, if you are able to increase your SID, which we cannot with this Paxis 100 machine, but the newer Paxis 100 machines like Butte, there's some in Boise, Rexburg, you can increase your SID, which will allow you to fit the whole TibFib on one film. Okay. If you can't fit, like I said before, we'll have to take 2 pictures. Okay, so let's do this. Welcome Mikkel and Kate again. There. Okay, either right or left, it does not matter. Okay, so the way I like to do these is to sit the patient on a chair. Make sure that chair has a back on it. Okay, we don't want wobbly patients going over backwards. But if you are going to do it this way, make sure you have a chair with a back. You can also do these tabletop. Either way, to me, it's easier to put the patient in a chair and crosswise on your image receptor. Okay, gives us a little bit more latitude. So we're going to have the patient put their leg up there. Okay, this is the AP projection. We're going to have Kate scoot forward for us. Okay, very good. Now, who we got today?
Sandy.
Sandy. Nice. Okay, come just a little bit further for me. Okay, now you can see that our light, where we're going down at an angle, we're going to catch that ankle joint. Okay, so we're good on the low end. We've got the knee joint right here. Okay, right at the apex of the patella. So we're going to be able to get Kate's all on one picture. Okay, so that's exciting. If we couldn't, we would take a lower, including the ankle, and an upper, including the knee joint. Okay, so it's just like doing an ankle. Make sure that foot's straight up and down. Dorsiflex isn't as important on this one, but nonetheless, uniformity is good. So do some dorsal flexing, okay? All right, central ray is mid shaft of the TibFib. You'll note that we have some light here and some light here, okay? We're gonna get both the medial and lateral skin margins, so we're in good shape there. We're gonna go ahead and put our marker right here in the light where we can see it. Okay, and we got ready to roll. We're going to shoot our AP. So we're going to shoot that at 65 to 70 kV at 10 to 12.5 mass. Okay, now we're just going to do a lateral. So this can be a little bit tricky for the patient. If they're wobbly or you feel like maybe they can't quite handle it, get the table over here and lay them down on the table. Okay. But we're going to see how Kate does. We're just going to turn your leg on your side. There you go. Beautiful. Scoot this way a little bit if you can. Okay. Bring that knee down. Perfect. Good job. It's nice to have a flexible model. Okay. Now, just like the ankle or the knee, I guess we haven't got to yet, but we've got the same distance between the ankle and the IR and the knee and the IR. So this is all in the same plane. Okay, we want a good lateral. We've got light up front, we've got light in the back, we've got light to the knee joint, and we've got light, thank you very much, to the ankle joint. We would just come this way a little bit. Okay, down a little bit. And there we go. That's our lateral. Okay, piece of cake. Just quick tip, make sure you got the same distance here and the same distance here. Okay, that's going to put your knee in a good lateral position. We want to make sure those condyles are on top of each other. Good close camera work, Kel. Way to go. Okay, and we're going to shoot that with the same technique. And that is our TibFib. Okay, question number 1, who's on Kate's socks today? And question number 2, what do you do if you can't get the whole lower leg on one image? What do you do? Or if you want to answer this one as well, either way, what can you do on traditional units and the newer Paxis 100s? What can you do to ensure that you get the whole TibFib on one image? There's your questions for the day. You can answer either one of those second ones. Anyway, thanks for stopping by, guys. I'll see you next time.